going to go ahead and get started. As I drop all my notes. I'm Linda Auerback. I'm the Substance Abuse Prevention Supervisor for Carroll County with the Carroll County Health Department, the Bureau of Prevention, Wellness, and Recovery. And we have a half hour today, and I'm going to split my time with a parent in the community who has lost a son, Beth Schmidt. So I'm only going to talk for about 20 minutes, but obviously I can't cover all the drugs that there are in 20 minutes. So I'm going to kind of give you, a quick 101 course, but please come and see our booth. We're right over around the corner, and we would be happy, to come out to your organization, your school, your church. That's what we do. Actually, there's you have a little PowerPoint, and some of it I'm just going to breeze through, but here's information about substance abuse, how much it costs, how many people it affects. But due to time, I'm just going to try to get, to the nitty gritty. Sorry, I have a box of drugs up here. So prevention, a lot of people don't really understand or know what substance abuse prevention is. Substance abuse prevention is actually a science. We have strategies, we have to report, we do assessments, so there's risks and protective factors. It's a lot more than just having a booth somewhere and giving out information. We really try to change thought process, of people with making decisions. Like we go into schools and have refusal skills, anger management, someone like critical life skills who may be making choices about using drugs or alcohol. And we also, there's perception, which you're going to see a little bit later in the PowerPoint, but, what the community thinks and feels, if they think that drugs are a problem, or serving alcohol, providing in the house, so that all falls under prevention. And actually there's prevention, there's treatment, there's recovery, and then there's relapse prevention also. So I'm really fortunate to be in this field of prevention because, we can come at it from all different angles. And I'm not limited to someone coming in my office to be my client. The whole community, the whole state, I can even go out of state. They're our clients. So I definitely encourage you to read a little bit about prevention because I definitely want to get to the drug part of this. And these are when I'm talking about the risk and protective factors. You really want to have a balance in your child's life. A lot of times there's risk factors that you can't help. Moving's a risk factor, transition from school to school, if your neighbor happens to be a drug dealer. But what you want to do is definitely have more protective factors to balance that out. It's almost, we want to raise really self-sufficient children that make good decisions, but you don't want to, put them in a bubble. But what we do want to do is surround them with healthy, what we call protective factors. And it does kind of protect them, and you don't know, it's not just one thing. It's not just like having meals together or having family discussions or being involved in Boy Scouts or sports or guitar or doing well in school. It's really a combination of things because you really don't know what will help your child when it comes to making good choices. Some of the challenges in our community, and you can obviously read this, but a lot of it is sometimes not just parents, but an older sibling, a neighbor. They may think it's okay to serve alcohol, or they may think if I take the keys, then your child is safe. And I'm here to tell you that's not the case. Your child is not safe. First of all, the addictive process begins early on. If you have a middle schooler, you can become addicted to alcohol in 6 months, whereas an adult over age 25 will be anywhere 2.5 to 10 years. And that's because your brain is still developing until you're 25 years old. So some of the challenges are the attitudes that we have that, well, my child's safe because I'm taking the keys. It's more than just drinking and driving. And if the parent is saying it's okay, or an aunt or the neighbor, that's a message that we're also sending to our youth, that it's okay to break the law. You're above the law. You don't have to worry because I'm going to, protect you with that. Some local issues that I'm going to talk about today. Drug facilitated assaults, and there's actually going to be someone here in a little bit to talk about sexual assaults. A lot of them are, in our community, drug-induced. They'll put something in their drink. We've heard of it more frequently in the past 2 years, and a lot of it I think is because of the synthetic drugs that we're seeing. It makes it easy because it doesn't knock someone out, but it kind of makes them compliant where they'll go with someone. Shoplifting, all those theft, of course, overdose, and it's actually higher than 90. I believe it's 95% of our inmates that are incarcerated in Carroll County are there because of drug-related crimes. Does anybody here know what a rave is? Let's see a show of hands. I see like 3 people. So, when I'm a parent too. I have 4 children, all 2 years apart. When they were teenagers, the raves were in Baltimore. We'd hear about it and the flyers would come out. Raves have moved to the county. The first time that I believe I was really aware was a couple years ago. A local high school sent me a flyer, and it was very evident it was a rave. They asked me, what does 6 mean? It was 6 in a circle, because they were talking about doing 6 at this party. But 6 is for 6 APV, and that's a synthetic drug, a hallucinogenic. And so they have moved to the counties. A lot of times they use abandoned houses. At that time, it was over in the Sykesville area, and it was a foreclosed house. And I actually went there the next day to see the aftermath. And a perfect location. They look for locations that had a municipal parking lot right across the street from it. They go into the back door, so people aren't seeing them. And we have heard of it over and over and over again now in our community. Sometimes they are on big farms. These are actually pictures from a rave in our community. And you can see there's hundreds of kids there. These are sometimes on school nights. There's typically alcohol, drugs, and I don't have the picture here, but I had taken a picture where outside you could see the prescription drug bottles, where this is going on. I know law enforcement has been working, to try to get these things under control in our community. And you know how we found out about these raves? The tips line. We had parents or neighbors call in, so definitely go to our booth and pick up a card if you don't have one. It's a collaborative effort between the state's attorney's office and the sheriff's office and the health department. And if you remain anonymous, that's how that information is going to get to the proper people. Anything but closed parties. We are seeing these again. These were popular about 1.5 years ago in our community. And it's not a costume party. If you come in a costume, they will not let you in. And these, some of these pictures, we have some that are of local high school students. That was, they go ahead and they put them up online, and it's free game for anybody to download them. But we had it verified from some local principals. So again, why are we concerned? Well, our job is to make you aware what's in the community. If you hear that term, if your child says they're going to an ABC party, this is what it is. These are some of the things that they wear. The CEOs and office host party, we actually had one busted in our community recently. And an adult was there. It was middle and high schoolers, and yes, most of them were intoxicated. Again, what's the message they're sending? So they start out at local bars. That's a flyer from a Baltimore place that hosts one. They go to the college level, and then unfortunately they trickle down in our community to middle and high school parties. And I believe this particular party, there were 35 teens and 24 were underage and intoxicated. And yes, a parent was there. So some dangerous trends that we're seeing is alcohol vaporizer. I know this one looks pretty elaborate, but you can just make it if you actually go around to our Underage Drinking Coalition booth. Carroll Mullen can explain to you how they can just make it with a soda bottle and a little hose. And what it is, it goes directly, it's going directly, it's bypassing where it needs to go. It's going right to your brain. It's very dangerous. And nothing really should go into your lungs but air, so when you're taking that vapor, it can cause a lot of health issues also. Not to mention, basically it's considered binge drinking, you can get alcohol poisoning. Butt chugging, we are still seeing this. again, stop by our booth. There's been deaths, not in our community, but in other communities. But every single time we go to some inpatient facilities, high schools and colleges, someone, and it's usually several people, talk about butt chugging. And why do you think? Why would somebody do butt chugging? Can anybody think of any reasons? Well, first of all, what we hear from the girls, they don't like the taste, there's no calories, but also if someone is a chronic alcoholic, it's bypassing their stomach and their digestive system. Or even if they're, or abusing drugs and their system is so, deteriorated, it's a way to get their alcohol intake. You also hear the term alcohol enema. I won't give the description because I think you can understand what it is. Carroll, I just volunteered you to explain how homemade alcohol vaporizer, how easy it is to make if they want to know. Oops, uh-oh. Another thing, that this has just been approved, you might have heard about powdered alcohol. I actually sit on a state team that's very opposed to this. We've heard of people already talk about snorting it and, as a way of ingesting it, sprinkling. They can just take their packet, to school with them. And another problem with this, they're actually promoting it as like a sports thing, while you're running. If you look at some of the advertisements for it already, and it is being sold in other states, it's, put it in your water bottle while you're jogging and running. It's like, what's wrong with this picture? So again, it's going to create more issues in our schools. So right now, this was supposed to, this has been approved and was supposed to be in the stores. And I believe that they got a year delay so that they can readdress just releasing it. But there's a Maryland collaborative for underage drinking with Dr. Jernigan, if you want to go online and check out the results. The last meeting I went to, they were still waiting to hear the results of it, but it has been approved here. This is just some information when you're legally intoxicated. Suboxone I wanted to mention because actually Suboxone was invented to help with opioid addiction. And what has happened now, it is being abused. They see it a lot in the detention center because you can get it in a film and it's easy to get in. And what happens a lot of times also, someone who's addicted to heroin or opioid prescription drugs, they'll abuse the Suboxone to keep themselves from withdrawing. They will kind of maintain, but they're not taking it as directed, they're not under a doctor's care, they're buying it on the street. And I've actually had young people, teenagers, the families come to my office and their child is actually addicted to this and they don't know where to go or what to do. Here's some signs and symptoms of the Suboxone. And as I move forward with into other opioids, you'll see a lot of the same type of signs and symptoms with vomiting, insomnia, nausea, drowsiness, sweating, depression. So our overdose data. And I know earlier, at the kickoff this morning, our state's attorney mentioned some overdoses. This is from the Department of Mental Health and Hygiene, and we only have through September. I checked yesterday, we did not get the last quarter yet. But as of through September 2014, Carroll County actually had 30 overdose deaths from alcohol and drugs. The state had 858, and last year in 2013 in Carroll County had 24. There's a number I do want to throw out here that I did recently obtain, and total overdose, not fatalities, but overdoses, someone going to the emergency room for what we call, when we talk about an opioid, we're talking about heroin and prescription drug. Last year in 2014, we had 893, which I really thought that was a lot. But then I got the total number for alcohol. So that's just those two drugs, the prescription drugs and heroin. So alcohol overdoses were even higher. It was 1,431. And that's just at one hospital. And to me, that kind of says it all. I have never seen anyone just pick up heroin as their first drug of choice it starts somewhere else. And typically it starts, and I think our numbers show, with alcohol. We have alcohol, marijuana. They do call them gateway drugs because it starts the addictive process in the brain with your brain sensors. And you can never go back. You can recondition and move forward, and that's where you move, from use to abuse, to addiction. So here's some pictures of heroin, a little bit of history of how it started from the Bear Company, and I'm just going to move along and let you read that because I want to make sure I get to our other guest speaker. But in 1914, they did realize that this wasn't helping with the morphine addiction, so they made it illegal. It was banned in 1924 by Congress. Some street names, some more data on here. As you can see, in 2014 up to September, just heroin alone, we had 13 deaths in our county. But remember, we had 893 overdoses. Again, the effects that can result in death. Pick up literature from our booth. It will detail what happens when you use heroin. We're going to have some speakers today that can validate all of these signs and symptoms. Last February, I was invited to be on a fentanyl heroin task force with the DEA, HIDA, and the U.S. Attorney. And it was because there was fentanyl that was being added to the heroin, and we were seeing a lot more deaths. And fentanyl, of course, is a painkiller that they do use for cancer. But in this case, it was being produced. It's a synthetic that was being made in labs. And the DEA has worked really, really hard, to try to stop this. This has happened a couple other times in our country's history from coming in, and they have been pretty successful. The fentanyl is 80 times more powerful than heroin and than morphine, and hundreds of times more powerful than heroin. And there is a slang term, and it's called poison, and it's called poison for a very good reason. And actually, when Beth Schmidt speaks in a few minutes, her son was the first one to die from a pure fentanyl overdose in our county. This is what's called Scramble. Again, I have all of this stuff, if you want to come and see it at my booth. This is the real thing. I had someone bring it to my office, and the DEA did pick it up. I have a fake here, if you do want to see it. It's a clear capsule. They call it Scramble, but this is, again, what they're buying, with the fentanyl heroin mix. This is just some information where it comes from. And 90% of the world's heroin comes from Afghanistan, but Baltimore's is manufactured from South America. It just comes trucked right up, comes across the border, and goes right to the East Coast from the Mississippi. Baltimore has always, for some reason, preferred South American heroin. I want to take a minute and talk about prescription drug abuse. What we have seen in the last couple of years with the development of OxyContin, which is a very potent painkiller. A lot of doctors write the prescription. Injuries, someone legitimately may need it, but it is extremely addicting. We in the field it's almost just like taking heroin in a pill form. It works on the same brain receptors, and you can see how many people become addicted. And prescription drug abuse is taking a prescription that is not meant for you, taking it too much of it, or taken in a way that is not prescribed for use, such as crushing it, snorting it, taking it to get high. 1 infant is born per hour with withdrawal symptoms in the United States, and that's an old stat, but that was as recent as I could find. And you can see, again, 15.7 million people aged 12 or older are abusing prescription drugs. It is a prescription drug narcotic. You can also abuse other type of prescription drugs, some stimulants and things. Those were not included in those overdose numbers. It was only the narcotics. Just again, warning signs, some data. This is a breakdown of actual prescription drug overdose and deaths. And what we see is a lot of times people switch from prescription drug use to heroin because their supply runs out, it becomes costly. One pill is $1 a milligram of Oxycontins or oxycodone. So if you have a 30 milligram, you're paying $30. If you're lucky enough to find an 80 milligram, you're actually paying $120. So heroin you can get for probably $5 for a little bag full like this. This one's approximately $50. So it's a whole lot cheaper. And your supply runs out if you're stealing prescription drugs or if you're getting them from someone's medicine cabinet. And that's another thing. We have to, just these campaigns to really encourage people to keep track of your prescription drugs. Don't leave them out. That your bathroom is the only room in the house you will let a stranger go in. Someone asks to use the restroom. And if you're having your narcotic prescription drugs in the medicine cabinet, you really don't know what they're doing in there. So we encourage you to keep them locked up, keep them put away somewhere, and especially away if you have a teenager, because it may not be your child, but it could be your friends, their friends. Purple Drank's another narcotic. I'm going to mention this because we did have a death out here that I know of. And again, it's like drinking liquid heroin. And it's a combination of codeine, Sprite, and Jolly Ranchers. And they call it, if you listen in the music world, double cupping. And actually Big Mo is deceased now at age 30. You'll see, they call it lean, scissor syrups. But again, it's in the music of our young people. Be aware. Weed or honey. This is interesting because what they're doing is melting down marijuana, and what they're doing is they're using it in e-cigarettes. If you come by the booth, we actually have it. The state's attorney's office was kind enough to send us a blotter, and it looked like LSD, and it's actually weed. It's marijuana. The THC count is much higher if you're melting it down and putting it in liquid form. Again, it's a problem in our schools because they can smoke it. It looks like they have a pen in their hand and they're blowing the smoke and the vapor down into their sleeve. And again, remember, it's not good for their lungs because it's vapor that they're putting in there. That's what the blotter looks like. Again, just new ways. These are current trends. That's the back. It looks just like an LSD blotter. Powdered caffeine, we have had a death on that, and this has been elsewhere very popular. And I believe some of our local team are familiar with this. They're snorting it for a cocaine-like high, and it can kill you and cause convulsions and seizures. So again, I do have all kinds of really cool things, but I'm out of time, that I would love to show you. This is a pipe, not a marker. We have a bracelet, lipstick that's really a pipe. So if you're seeing people with these, this comes apart. Please come by our booth. We'll have this all out to share with you. And at this time, I'd like to introduce Beth Schmidt.
Good afternoon. Thank you all for coming out this afternoon. This is my son, Sean. Wonderful, wonderful guy. Sorry, this is my son, Sean. I lost Sean to an overdose on December 16, 2013. Sean had been in recovery. Sean had been drug-free for over a year, and he, like many others, slipped up, was not around the same friends and the same family to encourage him to make the right choices, and unfortunately got mixed up with the wrong crowd. And as Linda mentioned, he was given pure fentanyl when he tried to use again, and as she mentioned, it's 80% more potent than morphine. So Sean did not stand a chance. And the most important message that I want to put out there about this is drug dealers will kill their clients off to get more clients. And that sounds counterproductive. It doesn't sound like it makes any sense, but it does happen. If I have the stronger stuff and somebody else is feeling sick and they want to feel better, they're going to come to me. Heroin dealers do not use their own products, and they don't use their own product for a reason. It's highly addictive and it will kill them. Sean didn't want to be this person again. Sean was a great person. Sean had many, many friends, and you don't want to wait until your child's viewing to find out how many friends he has. You don't want to wait until your child's funeral to find out how many lives he affected. Heroin can affect the lives of young, old, black, white. It doesn't matter. And Sean affected people in that way too. He was friends with people from every race, every walk of life, young and old. And because he knew so many people, I felt that it was kind of my responsibility to get his word out and to make parents listen and to make people learn. Sean came up from a family. He had two brothers. We did the dinners together, like Linda mentioned. It's not enough to do that. You have to really pay attention to your child. You have to pay attention to their surroundings. Sean was in treatment with Mountain Manor with one of the counselors that's sitting right here in the front row. We all did everything that we could have done for Sean, and Sean did most of everything that Sean could have done for Sean. And Sean took his friends to probation, and Sean took his friends to the recovery meetings, and Sean did everything he could to help others, but in the end couldn't help himself. We have to realize that we have to get rid of the stigma that surrounds heroin addiction and opioid addiction. And I know there's a lot of other drugs out there, and I'm only focusing on the opioids and I'm only focusing on the heroin, but that's my big thing. Like Linda said, it starts somewhere. Nobody starts with heroin. Sean did start with prescription pills that he was given to by an adult, by a parent who promised me that she would never let him smoke weed. And she didn't lie to me. She never let my son smoke weed, but she did sell him pills. Pills that eventually he and his girlfriend couldn't get anymore because they owed her too much money. Girlfriend started to overdose. Somebody else said, here, this will make you feel better. I can guarantee you heroin will make your child feel better if they are withdrawing from an opiate. If they're withdrawing from Oxycontin, heroin will make them feel better. They will never, ever turn back. They will continue on heroin until they get some help, and they need help out of there. We can't be ashamed anymore as parents. We can't be ashamed as families. We need to let these kids trust us. They need to come forward, and they need to know that we will help them, because they might have made one wrong choice. That might have been one choice that got them there. They might have been fooled into it. Somebody might have given them purple drank instead, and they're hooked. Like Linda said, the younger you are, the earlier you start with alcohol. It only takes 6 months for a middle schooler to become addicted to alcohol. Imagine how much quicker it can take for someone to get addicted to an opioid at a young age. They don't want to come forward. They're embarrassed. They don't want to hurt their family. They don't want to hurt themselves. They try to control it themselves, and when they try to control it themselves, that's when the opioid takes control. Too many times we look at someone who's an active user and we say, why don't they just stop? Why can't they just stop? Why don't they just say no? Their brain is being hijacked. Their brain is not producing the dopamine that it needs to produce anymore. They're not feeling good about themselves. They feel ashamed about themselves. They feel bad. They're afraid that you're going to feel bad. And it's just a vicious, vicious cycle. So, again, all I can say is know your child, know your child's friends, know your child's friends' families, and if it doesn't seem right, it's not right. Question your child. This is an epidemic. This is hitting everyone. This is hitting cheerleaders, football players, just the 4-H kids, for crying out loud. It's hitting everybody. Sports injuries are very, very scary. They're starting on opioids. They're starting on Oxycontin to make them feel better, and it's leading to an addiction, which can lead to heroin. It's much cheaper. It's out there. It's available. Don't fool yourselves and think that it's not there, because it is there. I didn't know any of this when Sean started, and this was years ago. It's cheaper now. It's more readily available, and I want people to know now what I didn't know then. I did everything in my power, and we've done everything in our power up until this point, and we did the right thing. We did the heroin kills, and kids know heroin kills. They don't know how addictive it is and how it will take your life before it actually takes your life. You will become a zombie. Your children will become a shell. I continue to say children, obviously, because this is my child. It can be anybody. This can start earlier, but my focus is the young adult. My focus is the teenager. This is in our high schools. This is becoming commonplace. My son went to a funeral the day he got out of jail for an 18-year-old. The person that she mentioned that died of purple drank played football with my middle son. I personally know way too many people. I carry a list with me. Unfortunately, it's in my purse. I carry a list with me. I started out with 15 kids within a 15-month period. There's over 30 people on that list. I carry it with me. I add to it when I can. I don't want to add to it anymore. I don't want this job. I don't want to do this. I wish that I had my son here, but I don't. So I would like his life to be able to save somebody else's. Thank you.